All right, we're jumping in a couple minutes early. So if this is the replay, just skip 10 minutes. This is my first time using this studio, so we're trying to figure it all out. Very excited for today, though. This is going to be fantastic. I've been working on this for months and months. Oh, Denzel, my boy. All right, good. Good to know that LinkedIn comments are working. So let me reply here. Let's see. All right. Healthcare Trailblazers podcast, best team in the world. All right. So it's telling me that I can't post comments back to YouTube, which I think is silly, but apparently they're working on it. But look at this. I can show your comment, which is cool. Huh? Yeah. Nice. All right. So if you guys are jumping in here, leave a comment if you're jumping in a little early. Of course, the day of my big launch, my voice is like completely giving out. So hence the T. Don't mind it. From the Healthcare Navigation Project. Let's go. All right. That sounds fun. Healthcare navigation. Now, oh, there we go. I see live viewers from LinkedIn, from YouTube, but not from LinkedIn. Interesting. Let's see. Nice. Okay, so I can't see the actual amount of people jumping in. So if you're jumping in, throw a comment in. I know we're a couple minutes early. We're going to get started in about 5 minutes. But throw a comment in the chat so I can see the good people of the LinkedIn. What am I drinking? Lemon, ginger, garlic, and honey and hot water. Best tea for this is not medical advice. This is not medical advice, but best tea for aching throats. All right, Sarosh, my guy, we're excited too. We are excited. Thanks for popping in the comments. Let's go. I'm probably going to turn off my phone so I can focus a little bit. I'm not the best at focus, but we shall try. We shall endeavor to be focused. Am I using LinkedIn Live? I am using StreamYard. First time really using it. Funny story. If you go to my LinkedIn, I posted a picture. I jumped on like at 11:30 just to test this, and I was wearing a blue shirt, and it totally was acting as a green screen. So it's totally messy. And I'm like, of course. So I ran home. Luckily, I live a half a block from my office. Ran home, got a quick white shirt on. So yeah, but I'm using StreamYard. Harvey Castro, top G right here. Good to see you, doctor. And Natasha, I'm pretty sure Natasha's a doctor. So maybe this could be still not medical advice for legal purposes on the podcast. But all right. Gargle hydrogen peroxide for a sore throat. Okay, sounds gross, but we might try it. I am streaming to YouTube and LinkedIn. That's who I'm streaming to right now. Harvey. Oh, plugging the new book. Love this. LinkedIn user. I don't know what your name is, but appreciate you. Yeah, we're going to talk about the book. We're going to talk about a lot of things. Natasha is a nurse. That is fine. Okay, we'll take it. It's more than I am from a clinical perspective. So very cool. Okay, still, they should really have a view count for LinkedIn. So that's odd, but otherwise, let's see. Once again, if you're jumping in here, we're about 2 minutes to start time. Super excited about this event. I have been biting my tongue on LinkedIn and not sharing about the project I've been working on. And so if you're jumping in now, we're going to get started in just a couple minutes. Throw a comment in the chat. I can't see who's actually on. There's about 250 people that RSVP'd signed up to be here today. And so if you're here, just throw a comment in the chat. Let me know that you're here. Also, getting used to this new setup. So yeah, you should be able to, I'm able to like click on comments and make it visible on the screen for you guys. And yeah, also let me know audio, video, things are looking good. If there's any glitches, any issues, just let me know. says 17. Oh, so you can see users. Cool. All right, appreciate you. That's from LinkedIn user. There's a lot of LinkedIn users that don't actually have a face or name. I wonder what that means on the back end. Huh. Meredith, you are the best. Good to see you on here. Very good to see you on here. Can hear and see. Thank you, LinkedIn user. Now, this could be multiple LinkedIn users. It could be the same LinkedIn user. We don't know. We won't know. Guys, 60 seconds to start. Suzanne Taylor, good morning from the West. Appreciate you being here. All right, and there we go. Now people are starting to come through. We got Adam excited to be here today, hear the discussion. Adam, we will not disappoint. You have my word. Sarosh, yeah, big news. It's going to be exciting. Amazing. Denzel, looking sharp as always with that profile photo. And yeah, once again, if you're jumping in, just throw a comment in so I can see, so we can engage a little bit. This is actually a relatively convenient platform, so this is good. I'm liking this. And LinkedIn user, you keep me updated on how many people and what's going on exactly. Okay, we got Marty. Good to see you. No problem. The pleasure's all mine. Once again, there's about 250 people that RSVP'd to be here today. So as you're jumping in, just go ahead, throw a comment in. Let me know that you're here. I've been working on this project for months, and I'm so excited to share with all of you guys. So excited to see who's on here and interact with the good humans of LinkedIn and YouTube. This is also streaming on YouTube, but LinkedIn. Hello from Georgia, Rodney Smith. Looking great. Look at that blue tie. Look at this guy, Rodney, everybody. Let's take a second and appreciate the Rodney. All right. Rodney Smith, looking great. Peggy, hello from Ohio. Nice. Ohio's not that far. I'm in Pennsylvania. And it is 12:01. And so this live has officially started, even though we jumped on a couple minutes early. And so once again, as you're jumping in, throw a comment in there. Let me know where you're from. Let me know that you can hear me, see me. And yeah, and for all of those, if people can make it today, don't worry about it. Look at this. Hello from Idaho. Nice. We appreciate the potatoes. Appreciate it's Idaho, right? We appreciate it. Very cool. Looking good, Danielle. Okay, we'll get started in just a couple minutes. London. Are you in London, Zia? Look at this guy. This guy's from the UK. That's cool. That's cool. Sarosh, looking forward to hearing about the future of integrating AI in healthcare and how we plan to regulate what data is being fed to train those systems. Fantastic topic. We may touch on it today. We don't know. I don't even know. I'm just here. I'm just a willing participant like the best of you, like the rest of you. I'm kidding. We're going to be launching something that is going to be earth-shattering and groundbreaking. And so really happy that a little over 200 of you guys signed up to this. And it's going to be good. It's going to be fantastic. All right, maybe we'll give it another 3 minutes. If you're joining us now, where's my guy LinkedIn user? Where are you at? What's the user count on LinkedIn? Let me see if I can join from LinkedIn. Or is that going to mess up? Yeah, we'll give it just a couple minutes. If you're jumping on now, throw a comment in. Would love to see you in the comment section. I am able to click on comments and throw it on the screen. And so, yeah, we've got people from, Sonia from California. Love it. Thank you, LinkedIn user. Appreciate you. Sonia from California. We got the emoji use. Very, very high tech, Sonia. Really, really with it. Fantastic. Okay. All right. So I think we'll get started. As you could see from the background and from the side. By the way, is the background, let me know if it's flipped, because you never know with these platforms, if they're flipping it or not. But anyway, the future of value-based care. The future of value-based care is here. Chris Schmaltz. Ladies and gentlemen, we have a legend in the house. And so Chris is joining us from Seattle, and Chris is a mega superstar in value-based care. Chris actually was a guest on the Healthcare Trailblazers podcast. So you can go check out his episode, and the passion that Chris has for value-based care and what it can do for patients is just comes through in all the work that he's done. So go check out Chris on LinkedIn, check out his episode on the Healthcare Trailblazers podcast. Quick plug, the #1 podcast in value-based care. And yeah, Chris, good to have you on here. Okay, so let's start with me. Who am I? My name is Mendel Erlenwine. I am the CEO of a company called Previva Health Group. And Previva is a care coordination services company. So we white label services such as chronic care management, remote patient monitoring, annual wellness visits, transitional care management, and behavioral health integration. Very specific preventive care programs that are reimbursable by Medicare, but very difficult to actually implement in-house. And so we have we stack up the technology and the workflow and the best, most efficient way of getting it done. We've got fantastic care coordinators, and so we're able to integrate with practices around the country. And if they don't have the resources to actually get these programs done, we're able to get it done for them. Let me just quickly make sure this is actually recording. And it looks like it is. Okay, cool. So that's what Previva Health Group does. And so over the last 4 years, I've been building this preventive care services company. And it's been really fascinating, and it's been a fantastic journey because these services really impact patients every day. And the services that we provide are technically, so this started getting me involved in value-based care and understanding value-based care. Why? Because the services that we provide at Previva Health Group are value-based care in nature because they're preventive and they're meant to keep patients out of the hospital and they're meant to better patient outcomes. However, they're still fee for service because they're actually paid by a CPT code. And so the way billing works in a fee for service world, fee for service, for those that are unfamiliar, is a term for traditional healthcare where you go to the doctor does a thing, doctor bills for that specific thing, and then gets paid for it. And so that's what fee for service looks like. And that's what most of healthcare is and has been traditionally. And so these programs, chronic care management, remote patient monitoring, annual wellness visit, they're all still reimbursed by Medicare and some other payers. And so they're technically fee for service, although they're value-based care in nature. So that got me kind of interested in value-based care. A couple months later, well, not a couple months later, but about a year and a half ago, almost going on 2 years, I started the Healthcare Trailblazers podcast. Maybe would have chosen a shorter name, maybe. But you know what? Action is always what counts. And so you just got to move ahead. So we wanted to start a podcast. I wanted to start a podcast to get the message of value-based care out to the world, peel back the curtains on some of these incredible people in this country that are creating better outcomes for patients, changing the state of healthcare by pushing it towards value-based care, mainly in the private sector as far as actual results, but definitely also in the public sector when it comes to policy and actually creating the incentive structure. So Medicare is the actual payer, so they have to actually enact creative ways of getting providers paid in a value-based care world. And so, yeah, I got to talk to just tremendous people. We've had in the public sector, we've had the chief medical officer of Medicaid on. We've had the chief innovation officer of CMMI, Medicare, Medicaid, the Innovation Center. We've had the chief strategy officer, Medicare. And then on the private side, we've just had just a host of fantastic people, including Chris Schmaltz, who's really great, worked at Panoramic Health, who's, I think, the largest nephrology ACO, but they do fantastic work. And we've had CEOs and chief medical officers from WebMD, from ChenMed, from Oak Street Health, from Northwell, from St. Luke's, the dean of Harvard Medical School, just fantastic people. And I'm saying that not to name drop, but to explain how I've been blessed to talk to some of the most impactful people in healthcare and really wrap my head around value-based care and its potential impact on patients. And so I want to take a quick minute and kind of talk about value-based care, because after all, the title of today's event is the future of value-based care. So before we talk about the future, let's talk about kind of the present. And so once again, if you're joining now, drop a comment in the comment section. Hello, Chelsea from Dallas. Good to see you. Drop a comment. Let us know where you're from, why you're tuning in today, anything about you, and we can click on it, show it on the screen. This is a very intuitive platform. I'm very, very happy about this. So value-based care. Fee-for-service, like I talked about earlier, is where the doctor is essentially paid for the service that they provide per service. And so everything that they do has a code. That code is billable. That code has a reimbursement amount, and they get paid. Eileen, good to see you. Michael Dudley, what a guy, from Pearl Health ACO. Fantastic company, by the way. And so if you think about it, fee-for-service is actually incentivizing sickness and not health, not better health. Because let's say a patient goes in for some sort of surgery, procedure, operation, and then they weren't taken care of fully. And then they get a post-op infection. They go home. Now they come back and they get that taken care of. So the doctor was paid for the surgery, paid for the follow-up, paid for any additional follow-ups. And so each thing individually is paid, while the patient, in the meantime, suffered unnecessarily, possibly. And so the incentive is actually on sickness and not on care. Flip that around in value-based care. And now there's a spectrum, a giant spectrum of value-based care arrangements. And so the most extreme understandable version is where essentially there's a benchmark amount, a baseline amount that the payer, whoever that is, let's call it Medicare for now. The payer says, all right, hey doctor, I'm going to give you $1,000 to take care of Mendel's health. Okay. And you're going to get that $1,000 whether Mendel's healthy or sick. Not only that, but I'm going to give you $1,000 for 10,000 Mendel's health. However, you assume the full risk of your patient's health. And so immediately you become incentivized to do the exact opposite. You have a pool of money and your job becomes to spend the least amount of money, less than you were given, at least, and provide better care so that the patients don't end up being really sick, so they don't end up in the hospital. I think the average hospitalization is like $20,000, $30,000. And so make sure that they're well managed upfront, so that they don't end up in the hospital. They don't end up in the ER. Their conditions are well managed. And so you flip the whole business model on its head. And like Dr. David Pate, the former CEO of St. Luke's Health System, talked about on the podcast, he's like, the things that make you the most money in value-based care lose you the most money in fee-for-service, and the things that make you the most money in fee-for-service lose you money in value-based care, right? So like if a surgery that was unnecessary costs $100,000, then that's $100,000 that you're paying if you took the risk on that patient. And so it would have been much cheaper for you to have, say, some care coordination, patient education at the outset, so that you that patient didn't end up in the hospital, right? Here's a simple example. Senior patient falls and breaks her hip. Falls in the shower, breaks her hip, right? And so now she goes and needs a hip replacement surgery. It's $150,000. So in a fee-for-service world, woohoo, the doctor just made $150,000. But in a value-based care world, you just lost $150,000. So it would make so much more sense for you to spend $100 on having maybe somebody call the patient, talk to the patient proactively, preventively, and understand that she doesn't have a bar in her shower. Maybe she's almost slipped once and it's kind of scared her. And so do a little more care coordination, spend a couple of extra bucks, and end up with a bar in the patient's shower. Now, statistically, you have just prevented that patient from falling and you having to pay $150,000. So by flipping the script and saying we're now going to pay for patients' health outcomes and not for sickness, you incentivize innovation. You incentivize, you align the incentives of the doctor together with the patient's health. And that's a beautiful thing. And there's so many examples of the innovation and what this does. And, a lot of people, they like to fetch, that's a Yiddish word for whining, about doctors making money in healthcare and people shouldn't be allowed to make money. This is America. People, and it's actually, whatever, this is for a different topic and a different time, but trying to say that doctors should only make a certain amount of money or whatever is maybe good for different countries, a whole different topic. But the smarter thing to do is align the financial incentive with the patient care and say, the way for you to make money is keeping your patients healthier. The healthier you keep your patients, the less they're in the hospital, the less money you're shelling out, and the more money you keep. And so it's really a great way. Michael Dudley says there are a number of leaders in specialist groups here on the webinar. Would love to hear how to best incorporate specialists in value-based care. Bundle payments don't work, in my opinion. If anyone is a leader in a specialist group that would like to, that would like to come on. I'm not sure how to make that happen, but maybe we can figure it out. But thanks, Michael. And so, a story comes to mind from Dr. David Pate, who I mentioned earlier. He was the CEO of St. Luke's. And what was really interesting about what he did is that he came into a fee-for-service environment and he grew from within the confines of a fee-for-service environment. He grew them into, he created a third of their revenue, $1 billion. They were doing about $3 billion a year. $1 billion in revenue, turned that into value-based care. And it's one thing to start, which I'm not knocking. It's very difficult to build a straight value-based care organization, but it's an entirely different challenge to create a value-based care environment from within a fee-for-service environment. And so, so he talked about one of the innovative things that they did as an outcome of this change in mindset, and I thought it was brilliant. And so he talked about how they had an issue where their post-op infection rate was it wasn't high, it was average, but it was higher than they wanted it to be. And he sat with his people and he said, how do we get this thing to zero? How do we get our post-op infections to zero? And what they did was they ended up partnering with a local microchip manufacturer. And by partnering, I mean they consulted with them. And because he thought to himself, he said, in microchips. So he went to them and they had the system, because when creating microchips, you have to be the air has to be so clean and so pure, very similar to surgeries, because if the tiniest impurity or wrong particle gets into the microchip, you can mess up that microchip. And so they had these air filtration systems or air detection systems to be able to detect those tiny particles in the air. And so he got those machines from them, put it into the operating room, and what they found was that they were basically working on a lean, on kind of the lean theory for the operating room and the procedure. So they basically were trying to do it in a way where only like the absolute necessities were inside the room and anything else was outside. And so multiple times throughout a surgery, they had people going in and out of the OR. And what they noticed from having these machines was that every time the doors swung open and closed, new air came in from outside, and that had little, impure particles or whatever was going into the patient and infecting the patients. And so that gave them the knowledge to then say, okay, let's pivot a little bit. Let's take everything that the person might need and keep it in the clean room. And this way, and this way doctors won't be going in and out. And that dropped their post-op infection rate to like not nothing, but really, really, really low, like insanely low. And the genius part is that the flip to value-based care, they're forced now. The whole business is, how do I keep our patients more healthy? How do I keep them not having to come back in? And so that forces it's not just because that's the best thing for the patient, because that's the best thing for the organization, and everyone's aligned. And so obviously this is, extreme examples, but that basically forces the stakeholders that are making decisions in an organization to really sit and think and say, how can we better care for our patients? And I think that's incredible. Ellie Marcus, superstar from Crown Heights, New York. Ali is one of my favorite singers, so go check him out on YouTube and LinkedIn and Spotify. Good to see you, Ali. And so, that's just one example. There's tons of examples over the podcast. And again, go check it out on YouTube, the Healthcare Trailblazers podcast. But one other thing that I've mentioned so many times, Dr. Gordon Chen, the Chief Medical Officer from ChenMed, they are one of the largest and most successful full value-based care organizations. And he came on the podcast, had a tremendous chat with him. And he said this one line that I thought was just genius. And he basically said that when you're taking a full risk for patients' health outcomes, that means exactly that. It means you are taking risk for the patient's health outcomes, which means that you can't just get away with giving a more colorful brochure or a better video or some sort of better, you have to actually get the patient to change their behaviors. And so in order to do that, at ChenMed, they train their doctors, and I think this was the line he used, not just to be experts in medicine, but to be experts in influence, or doctors of influence, which I thought was mind-blowing, because it makes so much sense. You have to train yourself and your doctors and your care managers and your nurses and everyone that is touching the patients to talk to the patients in a way that's actually going to get them to change their behaviors. And again, this that line of thought, those ideas, that innovation only comes from flipping the switch into value-based care. And so this is all to say why I think value-based care is fantastic. You can hear more on the Healthcare Trailblazers podcast, once again, the #1 podcast in value-based care, and hear from some tremendous people. And so going back to Proviva Health Group, where we offer, chronic care management, remote patient monitoring, annual wellness visits, transitional care management, and these various preventive care services, seeing the incredible effect and the results that this had on patients' health, these programs had on patients' health, but also recognizing that they're still fee for service. And so here's an example. Chronic care management is reimbursable by time periods. So you have to hit a minimum of 20 minutes of care throughout the month for the patient. The next block is 40 and then 60. And in a value-based care setting, that just seems silly, because one patient might need 6 minutes, a quick phone call to check in, just be proactive, check off some questions. There may be 66 years old and they're still working and they're healthy. And then another patient might need an hour, but the time is less relevant than the actual clinical outcome. So it's still being reimbursed in kind of an upside down way, where it's being reimbursed for time instead of actual clinical value. And so this has been the last couple of years of my life, really exploring value-based care. And between that and then seeing the practical results of care coordination with Proviva Health Group, I have been tremendously interested in the subject. Before I move on, I want to break this up a little bit. If you're here and you're listening, where's my guy, LinkedIn user? Where are we at with LinkedIn? And if you're here, throw something in the comments. Let me know you're here. Even just throw 1 in the comments. Just let me know that you're here and that I am coherent and speaking relatively clear English. Once again, today my voice is really down. So, but we'll try for the energy to be up. So yeah, just throw a comment in there. Let me know that that I'm making sense. Let's see some ones. Throw 1 in the comments. And I think this goes from LinkedIn and thank you, LinkedIn user, from LinkedIn and YouTube. So if you're on LinkedIn and or YouTube, throw a 1 in the comments and let me know, and we will get moving on the program. So the future of value-based care. I'm now going to move to November of 2022. So I have this obsession. Thank you, Eileen. I have this obsession with value-based care. November of 22, a friend of mine, Ari Rosenblum. Thank you, Rodney. Highly recommend go check him out on LinkedIn, actually. Ari is doing some tremendous things, in the mental health and wellness space. Tremendous fellow. Just got over cancer actually himself, and he's got 2 kids, and he's got a great mental health startup. Great guy. So he texted me and he's like, "Hey, have you seen this ChatGPT?" And I was like, "What is that?" And it had literally come out like the day before. And so I go, I look it up, and I promise you guys, for the first week, I thought it was ChatGPT, B as in boy. And so I start using it, and I'm like, this is insane. And I quickly, thank you, Sherry. I quickly started incorporating it into my daily workflows, content creation, drafting documents, just the basic draft, ideas, bouncing things off, and learning how to prompt it, learning how to, have it assume certain roles. And I'm not here to give a ChatGPT class. I promise you that. I'm sure you've all seen, this is the top 10 ways to prompt ChatGPT, but I really incorporated it into my workflow, and it changed a lot of the way I do things and how I do things. And I encouraged my my team members to start using it. I encouraged my employees from my content creation team, HR. Like I'm like, you guys need to be using this. And it's really funny. There was one funny thing where I have a tech support vendor who charges, I don't know, $100 an hour, whatever it is. And I was trying to get through an issue and they couldn't figure it out. And then I sat with ChatGPT for like 40 minutes and I got it done. And so I told them on our next call, I just want you to know, I sat with ChatGPT for 45 minutes and I got this thing done. And I said, I'm not telling you this to get you nervous and to say that, and like that you're losing your job. I'm telling you this because you need to be using ChatGPT, because it took me 45 minutes because I don't understand the language. And so I had to learn, what is this? What is this? What is this? What is this? Until I finally was able to, to implement. You guys speak the same language. You would have had it figured out in 7 minutes, right? And I say the same thing with my content creation team and anyone else, like you can be 1,000 times more impactful by using these tools. And so you should. And so that's just a quick general rant, how it's not gonna, Danielle Wagner, good to see you. And so start using ChatGPT, understanding, and it changes your brain a little bit to understand the application for AI, the implications of AI, and what it will do, what it will not do, what to stay away from. And so slowly, I started forming this idea in my head. And so I'll walk you guys through kind of the genesis of the idea, and then we'll launch the company. And that's what we're doing here today. So we're about to get into the exciting part. Throw something in the comments. Let me know you're with me here. And we're about to launch. We're going to change the background in the back. It's going to be fantastic. Okay. So I'm sitting there thinking, we've got all these care coordinators at Proviva Health Group, and there's a pain point. They are on the phone with a patient, then they hang up that phone, and now they have to document on that call. This presents a number of challenges. Challenge number one, they have to actually remember everything that happened in the call, which you hope good care coordinators do, but they're human. Number two is that the quality, right? They might put too much info in their note. They might put too little info in their documentation. They might use the wrong medical terminology. And number three is time. It takes a lot of time to actually get it done. And so there's quality, there's time. And I was like, wouldn't it be cool if I had a tool that would listen to the phone calls and spit out their documentation and their action items? And so then as I started thinking through that, my brain journeyed along this path where I said, you know what? Understanding, and I'm seeing all these companies out there that are trying to solve the entirety of healthcare with AI. And I don't think AI is there yet for a large part. AI is not going to be augmenting doctors yet. We're quite a ways away from like AI robotic surgery and really heavy applications in the medical part of AI, because we're going to have to get through a lot of red tape and a lot of training on the AI front. We're not talking about AI suggesting what movie you should watch or where you should go out for dinner. We're suggesting AI being involved in somebody's health. It has to be perfect. And so I basically, going back to what I was saying about the care coordinators, I started thinking like care coordination and education, patient education, is the perfect spot for AI to be applied. And it's the most immediately impactable, I don't know if that's a word, but impactable area for artificial intelligence. And so I start thinking to myself, and there's some companies that think that AI, so I split the care coordinator in half. And I think that we have to recognize that there's a unique value prop to the human and there's a unique value prop to AI, and they both have to respect each other. And so I split the care coordinator by heart and mind on the two sides. And the human is really, really good at the heart piece, right? That's the personality, the empathy, the delivery of care, the patience. And I don't think AI should try to take over that. There's some companies that are trying to do that, and I think that's a mistake. On the flip side, the human has to respect the idea that AI has a unique value prop, and that is in the brain department. AI's ability to amass and process massive amounts of data in an intelligent and usable way is, at the end of the day, unmatched by us humans. And so I start going through this understanding of like, this is the first area where AI can actually augment the human being. We're not there yet with traditional healthcare. We're not there yet with doctors. We may get there, we may not. But if I can have a deep understanding of care coordination and understand, and then this ties back to value-based care. Because in value-based care, once again, if you were here at the beginning, value-based care focused, the entire heart of value-based care is in the non-physician intensive care at the front end to better manage your patients so that they don't end up in critical care. And so the care coordination is all about asking the right question to the right patient at the right time to get them the right care in the most personalized fashion so that they don't end up having to go to the doctor. And this is a place where AI has the most immediate application. So I am launching a company called SoapNotes.ai. And I'm now going to very dramatically change the background here. Let's see if I could do it mid-thing. There we go. SoapNotes.ai. And SoapNotes.ai, as you may be able to see, is going to be the first company that is going to augment the human care coordinator with artificial intelligence. Boom. Okay? The company has launched. If you're excited, throw something in the chat, please. Okay? I've been working on this for I'm so happy to share this. Okay. What does that mean? What will SoapNotes do? Understanding what I just talked about, which is splitting the care coordinator down the middle with the heart and mind. That's going to be kind of the vision, the Northern Star. And so don't get rid of the human. Don't get rid of the pieces that the human is uniquely good at. Rather, let's make them be able to focus on that and be 1,000 times more impactful by leveraging artificial intelligence. So what will SoapNotes do? SoapNotes is going to do two things. It is going to, this is so exciting. Okay. SoapNotes is going to understand the patient's care plan. Okay. And that includes the patient's care goals, care challenges to getting to those goals, social determinants of health, population health understanding, resources available. It'll also have a library of content, again, parametered content, nothing touching kind of the liability side of this, which is, which is patient, like nothing on medical advice or diagnosing or anything like that. And most potently, it is hooked into the phone system, so it is able to listen to the phone calls between the patient and the care coordinator. Now, with that, SoapNotes.ai is able to do two things. The next month, before the care coordinator picks up that phone to call the patient, they are going to click a button in SoapNotes.ai that is going to say, create call plan. And it is going to build off those three pieces and create a plan that is a literal call plan, meaning introduce yourself to the patient saying X. So there's going to be like sections to the call. So the introduction, it's going to be hyper personalized to the patient, picking up with questions from your last conversation. So in the last month, the patient talked to me about how they had a head injury because they fell. And so some of the most immediate questions is going to be, have you had any additional falls since? Have you implemented any of the preventive measures that we talked about to prevent yourself from falling, any additional pain that you want to tell the doctor about. Then the next section, it'll move into general questions for their general care plan to kind of push them and nudge them towards their care goals. And the call plan is going to be built specific to the patient, specific to the time. In other words, today versus last month, and next month will be versus today. And also for the objective of the care plan, right? So different patients will be in different programs, et cetera. Now, the care coordinator. So Natasha asked, what is the role of the nurses in helping physicians? So, not sure if this is, yeah. So once again, not getting rid of the care coordinators at all, making them basically give them the ability to focus solely on the call. So instead of spending 10 minutes before you pick up that phone, looking through the chart, looking in the EHR, looking at your sticky notes all over your computer, looking at your notes from last month, and gathering all that info, you're going to basically have that at the click of a button. Then SoapNotes.ai will listen to the call and then spit out your SOAP note, which will have your documentation and your action items, which it then feeds directly into the data set for the next one and continues to build on for the patient. That's what SoapNotes.ai will do in the immediate. In version 3 of this, it will be live on the call, listening in real time and being able to prompt the care coordinator. And so going back to the vision of understand that the human is much better at the empathy, personality, heart side of it, and AI is much better at the brain. That is going to be the guiding light for this. And talk about basically the idea is we're going to decrease costs, because now you take a care coordinator that was spending all this time doing all this paperwork, administrative. So it's the administration side on the one hand to lower costs. So you're not searching through a bunch of things before the call. You're not spending a bunch of time documenting after the call. But then more importantly, especially for value-based care, more importantly is higher quality for the call. So it's going to understand the patient's goals and basically help push the patient towards there. So first of all, here's just a couple basic examples. And there's a bunch of questions flooding it. So I'm gonna try to get to them. Here's a couple basic examples. When a patient is not very talkative, as much as what happens more often than it should is where the care coordinator, because it takes a lot to kind of pull the info out of the patient. And so more often than not, the call looks like this, like, hey, hi patient, this is so-and-so. How are you? Doing well? Yep. Okay. Have you been in the ER? Any falls, any emergencies? No, everything's fine. Do you need anything from the doctor? No, that's fine. Okay. I'll talk to you next month. Bye. And it ends up being a 30-second conversation, right? The quality of that call, you're not really bringing value to the patient. With a call plan like this, it's going to spoon feed the care coordinator specific direct questions to move the patient on their goals. And it's going to cue them up with the right education and the right questions and the right way to ask it, understanding all the context that I described earlier of our previous conversations, your care plan, et cetera, social determinants of health, population health. It'll customize everything, what I call hyper-personalized. And cue that up for the patient, for the care coordinator, excuse me, so that now the quality, you're not getting through that call in less than 8 minutes. I mean, I don't know what that exact number is, but you're definitely bringing value to the patient. Let's talk about flagging systems for a second. If the right information is not being given, or if we're prompting the care coordinator to say specific, and ask the right questions in order to coordinate care better, and they're not. Instead of, that can all be flagged automatically. We're listening to calls, we're analyzing the calls, and so things can be proactively flagged. And so the possibilities for SoapNotes.ai from that point on are essentially endless. But the vision is we're the first company to augment the care coordinator with AI. We're specifically, and this is specific for, it's specifically valuable to value-based care, because once again, if you understand the financial incentive of value-based care, you can understand that the idea is I have this benchmark of money. Again, this is the most extreme example, but the idea is better quality, better health outcomes for patient at lower cost. Those are the two levers that you have to push in order to make money. And so this lowers costs and increases quality, and quality goes through the roof. Your care is hyper-personalized. We're tracking outcomes. We're tracking reasons maybe why outcomes didn't happen. If we want to get into population health and SDOH, social determinants of health, we start thinking, okay, why aren't we able to push this patient better on their goals? Maybe it's because we need to rethink some of that data going in so we can create better questions or better goals, and so it's the most implementable, practical way of providing the most hyper personalized care to patients, lower cost and increased quality. Okay, let me try to jump into some questions. If you have questions, please throw them in the comments. I will try to get to as many as I can. Is this incentivized in the same when you use AI versus just a human? Or how does incentives work in this model? So not 100% sure what you mean by that, but the incentives in value-based care would remain the same because the incentives are based on the outcome. That's what the incentives are based on. And so this helps you decrease costs and increase quality. So you're paying the same care coordinators to do more work because now they can handle so much more because all the time of the before and after the call has gone away. So now they can increase. And again, we're implementing this at Proviva Health Group. So we're beta testing everything. This isn't just an idea that I came up with in a closet. Oh, David, I'm going to get to that comment. Love that. And so we're literally, we're looking at the savings of cost. Let's say a care coordinator right now can only handle 320 patients a month. Now that can go up to 380, right? And so, yeah, the incentives basically on the dollar remain the same. Eileen, who are the intended clients? Health plans, basically any company that employs care coordinators. I'm intrigued. Thank you, Eileen. So in the immediate, these are the steps that we're going to do. In the immediate, all care management companies like CCM, RPM, et cetera, companies. And basically immediately after that, all the massive value-based care companies. So we're looking at the large value-based care systems. If you want to think of it as essentially anyone, the real answer is anyone that assumes the risk of the health outcome. And so in a value-based care world, this is intended for, that means basically the healthcare organization. If you move into a fee-for-service world, that might mean the insurance companies, because in the fee-for-service world, the insurance company is the one doing value-based care because they're the one paying out, right? So it doesn't really make much difference. The question is who's holding the bag. That's the question. And so, yeah, those are basically the clients. Anyone that's doing care coordination and has a direct incentive from lower cost and better quality is going to find tremendous value, and this is going to be absolutely revolutionary for their workflows. Zia says API interoperability and cross-border platforms. So one of the biggest things is that I feel like a lot of tech people are coming into healthcare and trying to do healthcare, and they don't really understand their end user. And so my thing is I am obsessed with value-based care. I have built a preventive care organization that provides these services. We employ these care coordinators. They are my team. They are the best team, and they do this every single day. So having a keen understanding of the focus for value-based care and the way that incentive structure aligns with quality, plus crossover with a real understanding of the behaviors of clinicians, is why we're building it in this way. So a lot of guys are creating like fancy Chrome extensions or complicated apps that you have to download and integrate, and it's a little bit complicated for the user. In their own words, I've looked at some of these articles where a lot of people are building technology for the providers for the doctors on the cutting edge of technology. And anyone in healthcare knows that doctors aren't even on the edge of technology, let alone the cutting edge. And so we're building in a way where it hooks into the physical phone system. So there's literally no additional behaviors being requested from the care coordinator. And then on the back end, we're going to look to obviously do the integration so that it ends up in the same endpoint. But we actually do have an exciting path where we may want to keep this separate because of some really, really exciting ideas that we're stacking on top of how to really, really drive quality and take that vision of basically the augmentation to the next level, which maybe I'll have to leave for another live event in a couple months. But that's on that question. I assume it will be using motivational interviewing standards to prompt the right questions. Love this comment, David. Love this comment. And you are exactly spot on. This is some of the secret sauce. This is the expertise that we're going to bring to the table, where if I'm building out the brain that is going to prompt the heart, that's the way I'm thinking about it and looking at it, then yeah, you're basically able to build it out in the most effective way. And so prompting the questions to be asked in a motivational interviewing style, making that hyper-personalized, not just to the patient, but even to the healthcare organization. So the medical director of an organization, they're often very frustrated that patients keep ending up in the hospital because they just say they have an issue and they're just being sent to the hospital. So medical directors of organizations could have direct input on these specific props for their for what they want for their organization. And so yeah, I think you're getting it. I think you're getting it really well. And so that is SoapNotes.ai. I'm not going to share everything right now. A lot of it is being worked on. It is implemented at Proviva Health Group. We are going to be implementing with initial clients very soon. And so very excited about it. If you guys haven't seen Unleashing Value, which you can't see the book because of the green screen, Unleashing Value, the Case for AI and Value-Based Care. This is a book that I wrote that basically I tried condensing all this into this half hour, 40 minutes here today. But this is available on Amazon and really goes through the entire really theory kind of behind it. And so you can go ahead and get that on Amazon. And yeah, if there's any questions, please plug it in the comment section. Where is my guy from LinkedIn User? Where are we at? Let's see. I'm going to take a breath for a second. So yeah, basically been working on this for a couple months. I think it's the future. All right, Marty's got an objection. Marty says, not sure that moving the care of the patient away from the doctor-patient interaction and basing it on CPT codes of billing will drive better care. That might be in reference to maybe some of the internal dialogue going on in the comment section, but we can talk about that for a sec. We're definitely not moving care away from the doctor-patient interaction. Yeah, definitely not what we're doing here. We're looking to take the care coordinator, specifically the care coordinator, and empower them with better data to create a better experience for the patients. Okay. Oh, I meant to say this at the beginning, and I meant to say it a bunch throughout. But anyone, Ellie, thank you very much. You're a top man. And by the way, the concoction that I have here of lemon and ginger and honey and stuff is thanks to Ellie. So thank you, Ellie. He's a singer, like I mentioned. Go check him out. We are giving something very exciting away to everybody that is on this call. So the landing page for SoapNotes.ai is live. And I'd like for every single one of you to go there. And we are going to be giving you a branded bar of soap. We are branding soap. It's a SoapNotes specific. It's going to be the what's the word I'm looking for? We're basically doing branded bars of soap for SoapNotes.ai. We're gonna have different notes like scents. So we're gonna have the whatever the main scent. The word is slipping my mind. Chelsea, thank you very much. And so go to SoapNotes.ai. You're going to see enter your phone number. We created this really cool text, which is going to come directly to me and the team, so we're able to interact. But there's like a text dialogue. So put in your cell. It'll ask you for your name, shipping address, and we're going to send you this really, really cool, this awesome bar of soap. I have it at the house. It smells fantastic. My entire office at home smells like this soap because I have a box of it sitting in there. And so we're going to be giving that to every single one of you that is on this call. Go to SoapNotes.ai. Plug in your phone number. We will be able to interact via text. Now, I only want to interact with people that are excited about the updates and not looking to spam anybody. So we're going to ask you about your communication preferences, how often you want to hear updates on SoapNotes.ai. And so really only get in there if you're excited about the future of the way value-based care is going to be executed on. The future of care coordination just changed. We're going to change the world with this. And as our country continues to move into a value-based care model, this is going to become, SoapNotes.ai is going to lead the way. We're going to be increasingly, just increasingly innovative and literally changing thousands of patients by driving down costs and bringing up quality. Once again, not getting rid of the human, really having a keen understanding of the unique value prop that each has, and empowering the human care coordinator to be 1,000 times as impactful. And so again, the possibilities are endless. but we're going to be able to do so many things to drive quality. Patients are going to be staying out of the hospital. It's going to be fantastic. So go to soapnotes.ai, punch in your cell, and we will be sending you, Marty, I think this question is actually for me, but who is the care coordinator? In your model, it would be the insurance provider. No. I am not really gearing this towards the insurance provider. I was just using them as an example of someone that takes the risk in a fee-for-service world. The real value is the care coordinator works for the doctor. Or the doctor. So take like ChenMed, Oak Street Health. These are I'm naming value-based care organizations. Oak Street Health, ChenMed, Alignment. It's a bit of a different style organization. But there are basically anyone that's doing care coordination, which really, Marty, to your point, should be working directly for the doctor. Patients, again, I have a care coordination company. Patients don't like getting those calls from the insurance. It's not personal. It seems like, hey, I'm just trying to get you to do things so I can save money. It's so much more impactful when it's from the doctor. So, and that's the whole vision of value-based care. To your point, Marty, the idea of value-based care is that the doctor is the one that assumes the risk, and therefore the doctor is the one that's incentivized to come up with solutions that will, keep their patients better managed and healthier. And so the care coordinator should be working for the doctor. What I'm describing as the value-based care organization, because I'm assuming that they're in a value-based care model from a payment perspective. And those care coordinators are going to be the ones that are going to find tremendous value in SoapNotes.ai, because it's going to allow them to focus on the phone call, focus on the patient, not having half a brain on the phone call, half a brain on jotting notes down, and then spending a bunch of time before the next call looking at their notes that they only scribbled with a half a brain and searching through a bunch of documentation. That's who it's meant for. And so I hope that answers your question. Eileen, really excited to have you on here. Eileen says, thank you for including SDOH in the solution. Yeah, it's like, we're going to build out this brain in the way that's going to be most impactful to patients. That's the vision. And so I think I haven't slept in, I'm sleeping at night, but very excited about this. And so I really think it's going to change the world. It's going to change the value-based care world. It's changing by the day. It's changing the care coordination experience for patients, for care coordinators. And so, once again, hop onto soapnotes.ai. Should be a quick little thing talking to you about asking you for your shipping information so we could send you this branded bar of soap. We'll ask you how often you want to hear updates. Really only want to keep a tight group of people that understand the vision and are super excited about the future of care coordination. And we're going to be really clear about not looking to spam anybody. Choose your communication preferences. I also put this book on half off for today. So it was $19.97. It's now $9.99 on the Amazon, the website, not the place. And so go ahead and check that out. Suzanne says, fully agree, SDOH is often excluded. Yeah, it's often excluded because it's not a priority, because fee for service. Why do I care about personalizing care to you if I'm just checking a box and getting paid? I'm only forced to care if my financial incentive depends on that outcome. And so if I need to change your outcome, that's when I get thinking like, what are your social determinants of health? Let's understand, what kind of population you're a part of. Let's understand what resources you have locally. That's when you start asking those questions. And so building this, that's why I'm saying this is the future of value-based care, even though on a kind of a micro level, it is going to change care coordination, but I think it's going to change the way that value-based care is executed on, and enable it to basically just grow in leaps and bounds. Rodney, thank you, Mendel. Thank you, Rodney. Thank you for joining on. We're about 52 minutes, a little over an hour into this, because we started a couple minutes early. So if anyone else has any other questions, feel free to drop them in the comments section. I am so excited to have shared this with everybody. Also, I'm going to be leading this in a super transparent way. I want to take my entire LinkedIn community along for the journey of how we're doing this, watch the data come out in real time of the effect that we're having on quality, on cost, on better patient outcomes. That's what really fires me up. And so want to take everyone along for the journey. There's going to be a tremendous amount of news over the coming weeks and months. We're putting together an A-list advisory board with people from top organizations in AI and value-based care. There's a lot of exciting things going on. The solution is really, really cool. And once again, I didn't come up with this idea in a closet. I came up with this around the pain point that my care coordinators at Proviva Health Group have, and we're able to beta test it with them and see the actual application. So I'm really, really excited about bringing this to the masses. Jump into soapnotes.ai. We'll send you that branded bar of soap. Signature notes. That's the word I was looking for before. That we're going to be sending a bar of soap that's going to be our signature notes bar of soap. And it is fantastic. Jump into soapnotes.ai, and that is it. It's going to be a text mechanism. Text me if you're interested in hearing more. If you want me to talk to you about kind of our early adopters program. We're looking for, we have a group of value-based care organizations and people that are heavy on the care coordination that will find tremendous, most immediate value from Soap Notes. And so, yeah, Suzanne, thank you so much. I appreciate you. Jump into soapnotes.ai, text me. It'll come straight to myself and the team. We'll be able to get right back to you. Once again, looking to do this in a really engaged way with my audience on LinkedIn. This is going to be a company that everyone is going to have an emotional and real stake in, because it is going to change your lives and the lives of your patients and care coordination, period. So with that, I am going to end this broadcast. Everyone that joined, thank you so much. If you're watching the replay, you can still jump into soapnotes.ai and get that bar of soap. We'll keep that chat up for that specific chat for a couple days. Otherwise, feel free to jump in there and text me. I will engage. God willing, we shall be in touch. Thank you all, and can't wait to share more updates with you.